Welcome. Today, we'll explore the fascinating world of the eye's cornea and uveal tract. These structures are essential for vision, and their health is crucial for clear sight. The cornea is the transparent front layer, while the uveal tract includes the iris, ciliary body, and choroid. Both are susceptible to various diseases, often presenting with inflammation and vision changes. Understanding their anatomy and function is the first step in recognizing and managing common disorders. Let's begin by looking at the cornea, its unique features, and why it's so important for our eyesight. The cornea is a transparent, avascular tissue that acts as the eye's main refractive surface. Its clarity is maintained by a delicate dehydration mechanism involving the endothelial and epithelial layers. This balance is critical. Any dysfunction can lead to corneal swelling or edema, which impairs vision. The cornea's unique structure, with no blood vessels, helps keep it clear, but also makes it vulnerable to injury and infection. Let's see how this remarkable tissue works to keep our vision sharp. Corneal edema occurs when the cornea's dehydration mechanism fails, causing fluid to accumulate. This leads to swelling, cloudiness, and blurred vision. The most common causes include endothelial dysfunction, trauma, or inflammation. Patients may notice halos around lights and discomfort. Recognizing corneal edema early is important for preventing permanent vision loss. Next, we'll discuss keratitis, a common inflammatory condition affecting the cornea. Keratitis is an inflammation of the cornea, often presenting with redness, pain, and sensitivity to light. The cornea becomes swollen and infiltrated with immune cells, leading to congestion and sometimes ulceration. Keratitis can be caused by infections, bacterial or fungal, spread from nearby tissues, or even allergic reactions. Early recognition and treatment are vital to prevent complications like scarring or vision loss. The causes of keratitis are diverse. Exogenous infections, such as bacteria or fungi, are common culprits. Sometimes, the infection spreads from other parts of the eye, or it may result from an allergic reaction within the body. Keratitis is classified as superficial, often ulcerative, or deep, which is usually allergic and non-ulcerative. This classification helps guide treatment and predict outcomes. Corneal ulcers, also known as purulent keratitis, are a severe form of corneal inflammation. They progress through distinct stages. First, necrosis creates a concave defect. Then, the ulcer regresses as healing begins. Finally, cicatrization occurs, where fibrous tissue forms to repair the damage. These stages are critical for understanding the healing process and potential complications. Patients with corneal ulcers often experience intense pain, excessive tearing, and sensitivity to light. Other symptoms include headaches and blurred vision. These symptoms can be quite distressing and usually prompt patients to seek immediate medical attention. Recognizing these signs is crucial for early intervention and better outcomes. Treatment of corneal ulcers focuses on controlling infection with antibiotics, providing ocular rest using atropine, and protecting the eye with a bandage. Once the infection is under control and healing has begun, steroids may be used cautiously to reduce inflammation and prevent scarring. Each step is carefully managed to preserve vision and promote healing. The uveal tract is the eye's vascular middle layer, consisting of the iris, ciliary body, and choroid. It supplies nutrients and oxygen to the eye and plays a key role in immune responses. Because of its rich blood supply, the UVA is particularly prone to inflammation and immune-mediated diseases. Understanding the UVA's structure helps explain why it's so vulnerable to disease. Anterior Uveitis, also called Iridocyclitis, is an inflammation of the front part of the uveal tract. It often presents with severe pain, especially at night, along with light sensitivity and redness around the cornea. This condition can be acute and requires prompt attention to prevent complications such as glaucoma or cataract formation. Patients with anterior uveitis typically report severe pain at night, sensitivity to light, and a red, congested eye. These symptoms are often accompanied by blurred vision and discomfort. Early recognition and treatment are essential to prevent long-term damage to the eye and preserve vision. On examination, anterior uveitis reveals a constricted or irregular pupil, a muddy appearance of the iris, and the presence of keratitis precipitates tiny deposits on the corneal endothelium. These signs help clinicians confirm the diagnosis and guide appropriate treatment. Recognizing these features is key to differentiating uveitis from other eye conditions. The management of anterior uveitis involves using cycloplegic agents like atropine to relieve pain and prevent complications, corticosteroids to reduce inflammation, and addressing any underlying causes. Timely and effective treatment is crucial to prevent vision loss and recurrence of inflammation. Some eye inflammations are particularly severe and can threaten the entire eye. Panophthalmitis and Endophthalmitis are two such conditions involving widespread infection and inflammation. These require urgent medical intervention to preserve the eye and prevent systemic complications. Panophthalmitis is a purulent inflammation affecting all structures of the eye, including the outermost layers like Tennant's capsule. This condition is extremely serious and can lead to loss of the eye if not treated promptly. Aggressive antibiotic therapy is the mainstay of treatment, aiming to control the infection and limit damage. Endophthalmitis is an acute inflammation of the eye's posterior segment, often following surgery or trauma. It presents with pain, vision loss, and redness. Treatment involves intravitreal antibiotics directly into the eye and sometimes surgical removal of infected material through vitrectomy. Rapid diagnosis and intervention are critical for saving vision. Let's summarize the key concepts of corneal disease. The cornea's clarity depends on its structure and dehydration mechanism. Infections, trauma, or immune reactions can disrupt this balance, leading to edema, keratitis, or ulcers. Early recognition and targeted treatment are essential for preserving vision. Diseases of the uveal tract often involve inflammation, such as anterior uveitis. The uvea's vascularity makes it prone to immune-mediated reactions. Recognizing symptoms like pain, redness, and vision changes is vital. Management focuses on reducing inflammation and treating underlying causes to prevent complications. Let's visualize the progression of a corneal ulcer. The process begins with necrosis, forming a concave defect in the cornea. As healing starts, the ulcer regresses, and finally, cicatrization occurs, where fibrous tissue forms to repair the area. Each stage has distinct clinical features and implications for treatment. To better understand anterior uveitis, let's look at a schematic of its key signs. These include a constricted or irregular pupil, muddy iris, and keratitis precipitates on the corneal endothelium. Visualizing these features helps in clinical recognition and diagnosis. In summary, diseases of the cornea and uveal tract can significantly impact vision and quality of life. Early recognition of symptoms, understanding the underlying mechanisms, and prompt, appropriate treatment are key to preserving sight. Whether it's corneal edema, keratitis, uveitis, or severe inflammations like panophthalmitis, a systematic approach ensures the best outcomes for patients. Thank you for joining this overview of corneal and uveal diseases.